Explain what's going on here. There's a big difference between getting onto the site, logging on, and signing on, right?
Yeah, Neil, I mean, the problems just never seem to end with this. So you're exactly right. The website itself is really the least of the problems. But one of the new problems that we're discovering is people go to the website. They now finally manage to get through, at least some of them. My wife couldn't.
Really?
Just yet. Yeah, and my wife is very sharp, I promise you. Couldn't get through.
A U.S. senator's wife couldn't get
right. Well, as you know, members of Congress are forced onto the Obamacare.
Right.
This is, we're losing our existing coverage. We're forced onto this.
Did you have any special passcode or something like that?
We got no
go to the front of the line?
No, we go
Disney
to the
Pass?
website.
Nothing like that.
And it doesn't work for my wife either.
Wow.
So, yeah, so believe me, I understand exactly what people are going through because we're going through it. On
Well, what do you
January 1,
find?
we
What
have
did
no
she
insurance.
find when she got on that? It was a one size fits all.
It took her information. It took her data. So she gave all our personal information, all our identifying information, and now that system, such as it is, has it. And then when she queried it for various plans that are available, it denied her, just wouldn't give her that. She went back later, tried again, still couldn't get access to that sort of menu of choices. And then she called somebody and said, can you help us navigate this? And they said, well, it's just not working right now. Best to try again sometime. So it's still a problem. But your question is, what about the people who actually think they've bought a policy? Turns out some of the information sort of on the back end of the system might not be making it to the insurance company. So you think you have an insurance plan. The website told you you did. You go to your doctor, you go to the hospital, you have a service. Turns out the insurance company doesn't know who you are.
Do you get anything, Senator, that says, all right, let's say Aetna is going to pick you up, United Healthcare is going to pick you up under this policy. Do you get any temporary ID or pass
Good
or
question.
number?
I don't know the answer. We haven't been able to get that far in the system, you know, my family. I'm not sure what kind of documentation or manifestation a person would have of a plan.
So, but the president is saying today, as I'm sure you're aware, Senator, that look, the benefits outweigh all the problems these Republicans are talking about. Lifetime medical care caps have been removed. You can keep your kids on your policy longer. Millions more uninsured will now be insured. Now, you pointed out very early on that this was going to cost you. This doesn't come free. But now that seems to be what they're saying, that more will benefit than will not.
Yeah,
what do you think
ridiculous.
of that?
First of all, let's look at the big picture. By the administration's own accounting, about 90% of Americans already had health insurance. The number they used to use was 30 million that didn't. Out of a country of 300 million, that's about 10%.
Right.
So we have turned the entire healthcare delivery system of America upside down for what they said was a 10% problem. And by the way, they're making it worse, Neil. It's based on a flawed premise that the government should decide for you what insurance plan you will be permitted to buy is outrageous.
All right, so
you
this is an Alamo issue for Republicans. I understand that. But it's black and white for a lot of you guys, too, right? So the governors like Kasich in Ohio and Christie in New Jersey that do take federal funding for Medicaid to expand it on their own, but not Obamacare per se. Are they just as pregnant, just as a little bit pregnant?
You know, I'm not going to pass judgment on the decision they have
to
make.
Go ahead, please.
No, but I'm not sure, right? I'm not familiar with the circumstances in Ohio or New Jersey, for that matter. Those are specific.
If you were
to
governor of
those states.
Pennsylvania, would you take the money?
I think I'd have a hard time expanding and accepting Obamacare because
does that compromise either of those gentlemen in your eyes?
Again, I don't know whether or not it does, Neil, because I don't know the circumstances. But here's my concern. The federal government's making a promise it's not going to be able to deliver. The promise that it's going to pick up the tab indefinitely when the federal government is already more broke than any entity in the history of the world, literally. The debt that we have mounted is so massive and so unsustainable that the idea that the federal government is going to pick up the tab on a huge new expansion of an existing and already unaffordable entitlement, I'm not buying it. And so I think it's going to end up falling on the laps of the states that have chosen to do that.
We shall see. Senator, great seeing you again.
Great to see you, Neil.
Pat Toomey. All right, in other good news today.